Hello, my name is Professor Alison McMillan and I'm the Chief Nursing and Midwifery Officer at the Commonwealth Department of Health and Aged Care. Today I want to talk to you about living with COVID-19 in winter and why we need to be extra careful compared to in the summer and how best to prepare for a case of COVID or the flu. Essentially, winter increases the risk of infection from many respiratory viruses because when it's cold, we naturally stay indoors more, there's closer contact with other people, and it provides the perfect conditions for COVID or influenza to spread from person to person. In the winter months, and we know it's hard to remember the summer at the moment, but in the winter months we do know that disease can spread more easily, as opposed to in the summer where we tend to spend more time outdoors. So what do we need to do to stay safe against illnesses in winter? Firstly, of course, vaccination against COVID-19 or flu is your very best protection and the protection against these diseases. It's okay to get both vaccines at the same time if that's more convenient for you. And with flu returning with a vengeance after 2 years of not being here due to lockdowns and closed borders, unfortunately, many of us are more vulnerable this winter. Flu and COVID symptoms are very similar, so please don't take the chance and assume it's one or the other. Get tested if you have symptoms. You can take a rapid antigen or RAT test at home or a PCR, but particularly if you're a high-risk group, an older or First Nations person, or if you have underlying medical conditions. Very important to talk to your doctor. New oral antiviral treatments for COVID-19 are now available, so check your risk factors at health.gov.au and, as I said, talk to your doctor about eligibility. Preparing for winter illnesses also means that you need to prepare that you may need to go into isolation. So make sure that you've thought about what you might do if you need to go into isolation as a result of COVID. We know even if you've had COVID recently, some people are being reinfected very quickly. Also, flu and COVID can make you feel very ordinary. So make sure you have basic supplies at home and identify someone who may be able to help you. You can certainly find out more about preparing for winter illness at health.gov.au. Thanks for watching.